The data shows that approximately 1 in 4 individuals in Wisconsin suffer from mental health and behavioral health issues. So it's evident that the HW Endowment should invest resources to support our communities in the hurdle of overcoming these issues.
My first impressions of the project were that the structure of it was unique, that there was this planning period, a specific implementation period, and then a sustainability phase. And although those things tend to happen in grant projects, they're not always so organized that way. And we had so much time to plan and so much time to implement and think about sustainability. I think that really sets up the project for success.
At the HW Endowment, we knew that the complexities of tackling behavioral health in these communities was beyond any one organization to tackle on their own. Thus, the importance of coalition building in communities so that a group of organizations, along with systems within that community, could tackle these issues together.
Our project is housed in Racine County, and it's throughout the county. It's not just the city of Racine, so that is made up of multiple cities throughout Racine County. We have a kind of unique setup where the city of Racine is considered to be urban. It's a larger school district. This school district, Racine Unified specifically, is the 5th largest in the state. As you go throughout the county, you see much more rural, so you get kind of a dynamic of urban and rural dynamic if you're in the city or you're in the county.
The coalition was formed from an existing coalition in Racine, and so sort of like a break-off coalition from what was already existing. And this new coalition was focused on the outcomes of this project, which is social emotional learning of young elementary school students in Racine. So people from the original coalition were invited to participate in this new one, and then of course the project manager reached out to more community members and school members to invite them to participate, and we developed work groups around each of the strategies that we had devised for the grant. And really that structure held throughout the whole implementation process.
So in 2012, the Johnson Foundation here in Racine did a research project called Top of Mind. And what they found was that there was, through the lens of looking at children's mental health, they noticed that there was no data around the elementary age in terms of their mental health and their mental wellness. There was no indicator throughout the city of Racine of how elementary age students were doing. And what they found in not only recognizing that the data for the Youth Risk Behavior Survey that starts in the middle school was that about a quarter of kids had symptoms of what would be anxiety or depression. The YBRS, or the Youth Risk Behavior Survey, is not a diagnosable tool. It does not diagnose, but just the flag that there were some mental wellness issues going on. And because we didn't have any data starting at the elementary age, we didn't really know what was going on. How are kids going from pre-K, where they have emotional milestones that the teachers are actively looking at, that kids were 85 to 90% doing really well. And then we get this downtick in middle school, so we wanted to figure out what was happening in the middle. So once that research study was completed, the Collaborative for Children's Mental Health was born, which is now housed within the school district. And they were doing more work through middle and high school to try to reduce some of that data they were seeing in the Youth Risk Behavior Survey. So then this coalition, this project, gave a great opportunity to be able to form a coalition around focusing on the elementary school age.
So we're concerned overall about youth mental health, especially the results from the Youth Risk Behavior Survey, which were showing very high rates of anxiety and depression and suicidal ideation. And the causes of youth mental health struggles are many. They include adverse childhood experiences of discrimination and isolation, maybe peer relationship issues, problems at home. And so there are many different causes for that. And it's hard to think of an area of life that would not be impacted by poor mental health.
Many people referred to our area as a mental health desert. And we found that really not to be true, that it was more people didn't know how to access those resources more than the actual shortage themselves, which that is something that we can more effectively have impact on versus trying to, in that same time period, try to hire or get more folks educated to be able to do that work. So that was the first thing that we identified. So that's why we have tried really hard to increase the perception and the awareness and the actual access of mental health resources. One of the ways in which we did that was create our community resource website that directly connects people to mental health services.
One unique aspect of our website is that we worked with our coalition and the Network of Healthcare team to develop the behavioral health referral pathway online. So it's an online referral system where an individual can fill out a referral for themselves to see a behavioral health provider in the community or someone in the school.
So our project is innovative in that it takes both a prevention and an intervention perspective. So we're working with young children, elementary age children, to provide them with the skills that they need to help secure their mental health and have positive coping skills when they're experiencing struggles. So that might be called like a universal intervention, sort of a prevention perspective to prevent problems from becoming crises.
We piloted this mindfulness program in one of our elementary schools. By the time that the year was coming to a close, this particular elementary school was rapidly coming to us saying we love this, and the evaluation that we were doing at the time supported what teachers were seeing in their buildings, and that this was a very helpful tool to have kids come back from recess and engage in a mindfulness practice, and how much that really helped the rest of the day and helped that transition. They started to use that same program for other things to increase mindfulness of students. So by that simple one school subscription, Racine Unified expanded that throughout all of its elementary schools, which at the time there were 20. All 20 elementary schools had access to this mindfulness program.
This funding opportunity has allowed us to partner with the school district and ultimately resulted in a policy change at the school district to have a given amount of time, 10 to 15 minutes in each school day for social emotional learning that is dedicated for that.
And being able to put in a mindfulness program and see the usage that has come out of it has been incredible to see, the amount of buy-in that we're getting in our community around mindfulness, and also the support from Inner Explorer being able to share back with us like how strong we've been able to implement this program and how much it's getting utilized.
Our hope is that the resources and the capacities that have been built within the backbone organizations in each community, as well as those coalitions, will strengthen the communities and enable behavioral health strategies to live on.
So the ABH initiative actually forced us to think about sustainability, and I mean that in a positive sense. It's been on the table from the beginning. So we are now moving into the sustainability phase, but we've been thinking about it all along. And so I feel confident that there are programs that we're putting into place, including the website and the things we're doing with the school district, that will be sustainable in the long term.